Hey everyone, welcome to Listen Love Connect. I'm Savanna Palafox, your host, and today's guest is the one and only Somiari Fubara, and we are going to be talking about the effects COVID has had on our mental health. So let's head over to Somi and get started. Listen Love Connect is brought to you by Exceptional Heroes.
We are talking about COVID-19 and the effects on our mental health.
Yes. Oh my goodness. And we could talk all day for 2 years about this because believe it or not, we are getting ready to sell. Well, I don't know if it's a celebration. We are getting ready or coming upon the 2-year anniversary of when COVID hit, or when it was here in January, but at least here in New York, things didn't get really crazy till like March 20th, and then all the shutdowns happening.
I feel like in the beginning of 2020, it was a lot of, well, it's not going to affect us type thing. Not really sure because the government and everything was not giving us enough information. So yeah, I feel like everything was around March when everything was like escalated.
Yep, I agree. So let's talk a bit really quickly about the shutdown and the anniversary of COVID coming up. And I know this after almost 11, 12 years of specifically working with trauma survivors, that the anniversary of a traumatic event, which COVID has been extremely traumatic, will a lot of times because your body keeps score and your mind remembers and the emotions attached to the memories, as the anniversary is approaching, you go there. Like sometimes even the week before, 2 weeks before, the week or 2 weeks after, you almost are reliving, not almost, you tend to relive how you felt, what things were, during that time frame.
And it's hard too because we're still living it. Yeah, we're not in shutdown mode, but there's still a lot of things that it's affected.
Yes, completely. So the first thing I will say to anyone listening is that don't take this impending anniversary lightly. And that kind of leads me to something that I also mentioned to anybody that has had a traumatic experience with anniversaries. Every year there will be an anniversary of COVID-19, just like every year there's an anniversary of 9/11, or every year there's an anniversary of whatever traumatic event happened to people individually. But I often feel, and I've seen this work very well, that having an physical and emotional safety plan in preparation, knowing that every year this anniversary is going to come up, is so important. The other thing too I would mention is that, I'm not making light of this in the sense of, for a lot of people, they lost so much. Not only people lost jobs, people lost, loved ones, people felt like they lost themselves. So it's not, just, go and do something. That's not what we're saying.
No.
What we're saying though is giving the understanding that this anniversary it's going to be here.
It's whatever works for you.
Right. It's what works for you. Like, what are you able to put in place and implement so that you're not triggered, to the point of being very dysregulated or reactive, or it doesn't cause an emotional and body shutdown. Because what can happen when you're triggered is that mentally and physically, you just have a shutdown. It's like it's overload, the mind is doing its thing, the body's doing its thing, and it becomes too much. and we're not able to function or even just be. So that's what we're referring to is having, and if you need to remember in a certain way, you want to do some kind of a memoriam for whatever you lost or for that time period, it's whatever is helpful from a healing perspective to ensure that you are responding instead of reacting on that day.
I know for me, on my take on COVID is different from Somi's, and it could be different for everyone.
Yes.
So having that safety plan is very important, whatever that looks like for you.
Yeah, and like I said, because, and Savanna actually mentioned this, because we're still in the pandemic. For some people, physical safety is still a huge issue, meaning, whether staying 6 feet away and not contracting COVID, especially for those that have pre-existing conditions or other conditions that if they get it, could be really put them in bad shape. Or those that have gotten it twice already or once already, because there's some people that have gotten it several times and that has just completely taken a toll on them. So for some people are like, well, physical safety is still a challenge. I would say that the emotional safety is equally as important, where you are emotionally and having a safe space to either process what you're feeling, how you're feeling, what's going on. That's all very, very, very important. Is that one of the things that COVID-19 has done is created quite a bit of confusion.
A lot, yes.
And one of the first confusing things was the mask, and that's why we did that. So what was your experience, Savanna, regarding, starting from March of 2020 up until now regarding the mask?
So for the mask, for me, I liked them and I didn't like them. Because COVID came shortly after me coming home, it felt kind of like a safety because like no one got to see my face or anything like that. So it was a little bit like a safety blanket, but then it also triggered me. And I couldn't figure out why it was triggering me until a couple months ago. And the reason why it was triggering me was because of my attack and having a hand over my mouth. So depending on the mask, like some masks I am okay with because there's a little bit of room to breathe. And I don't know if that's bringing in COVID more, but like the ones that are like right on top of me, it just gives me so much anxiety. And I actually remember a story, me and my grandpa, it was like just when the shutdown lift happened where we were able to go out. I had to go to the pet store and me and my grandpa were shopping around and we had our mask on and I was just panicking. I felt like I couldn't breathe. It was just a panic attack and I go, Papa, we need to find a corner of the store that no one's at and so I can take a break. And he was like, oh, good, Mija, me too, because he was freaking out because he's claustrophobic. So even that mask was just too much for him. So we went to the corner, we took a break. We probably hyperventilated at first, but then we remembered to do the 4 in, 8 out. But yeah, the mask was very controversy for me. Like, I'm not against masks. I understand why we have to wear them and stuff, but it is something that is hard to do because of my past. When we came to visit you in New York, that was difficult because everywhere you had to go, I feel like even outside you had to wear a mask because you guys are so strict. Where I live in Arizona, we're a little bit more relaxed now. And so it's a lot easier to go out. Of course, we keep our 6 feet if we're not wearing a mask or anything like that. But yeah. How about you? What about you with the masks?
So it's interesting. So yeah, and I want to make point that we're not saying, this is not a conversation about wearing masks or not wearing masks. Yeah. Everything in relation to just the mental health aspect and how confusion can play a role in that. So interesting, my son and I, Mara, were I would say before New York put a mask mandate in, we were wearing masks. I remember asking my sister in Texas, because, you know, when this all started, New York was the epicenter of COVID.
Yeah.
And it was really bad. And I remember we got through that part, you know, the shutdown, you know, New York being the epicenter, everything, without getting COVID.
Mhm.
Because I just looked at it like, okay, even though the stuff that the CDC was saying, I would say 90% of the time it was so confusing. Like,
Yeah.
1 minute they were like, oh, it was 13 feet, then it was 10, then it was 6, then it was 3, then it went back to 6 feet, then it was this, and it was just, I mean, even now it's just, with the CDC, I'm just like, okay, and I
Like,
probably,
really believe.
right, you didn't know what, because even with this last switching from 10-day quarantine to 5-day quarantine, when I found out that that was done because the CEO of Delta wrote them a letter like a week or two before saying, listen, this quarantine thing is big, my business, and the employees are not, you know, we're short of staff. And then literally a week later, the CDC is like, oh, well, you don't need to quarantine, you know, for 10 days. And then they were even, I think at one point they were even saying that, even if I don't want to get it wrong, but there was some confusion as to, if you tested positive, could you just wear a mask and still go about, especially if you're asymptomatic? Could you wear a mask? You know, could it be business as usual? And I was just like, what in the world? But going back to the mask thing, my son and I were, I think in January, we saw a lot of people, particularly of Asian descent, wearing masks on the trains. And at that time, we're looking at them like, yo, why are you guys wearing a mask? This was in January.
Yeah.
So just all the information started coming on. And I just, from a motherly instinct, I was like, dude, we're going to wear masks. However, there were no masks. You couldn't buy masks. I mean, even like on Amazon in the stores or whatever, it was like, there were no masks available.
Yeah.
So I had my sister send me some cloth masks that we used, but they had filters. And we used that until we were able to get like actual, like, you know, the more disposable masks, which we'd use now. So from the mask, and you're right, here in New York, it was a mask mandate put in back in March of 2020. And we just lifted the outdoor mask mandate, I believe.
Okay.
Or lightened it a bit, and they're thinking the indoor mask mandate is probably going to be lifted, but most New Yorkers are still wearing masks. And in certain places, you can't get on the subway without one. You can't get on the buses without one. You can't get on a plane without a mask on. So that's what is kind of confusing. What is the difference between a restaurant and a plane?
Right. Yeah.
Or the restaurant and the subway, or the restaurant and the bus? It's all indoors.
Yes.
Or anywhere you're going. So even yesterday, my son and we went to do some activities and everybody had a mask on. It's like, so the masks to me, and now that they've switched to, I never did, other than the first few weeks when we couldn't get masks, I never really did the cloth masks. I always did either the medical ones or the stronger, just disposable ones. But again, I think the confusion is we don't know what it is or not. What we do know that is COVID is highly contagious.
Yes. And I actually have another story.
Mhm.
Just on how it affects kids that are growing up, like from newborns and all the way up. My mom and I were in Target once, and we weren't wearing a mask because it was lifted and everything like that. And we had our vaccines. And yes, I know we still can get it with even having vaccines. But anyway, we were in Target, and there was a little girl, and her dad were wearing masks. And the little girl goes, Daddy, they're not wearing masks. And she was kind of panicking. She looked like she was 2 or 3. And she's like, they're not wearing a mask. They're not wearing a mask. And they're getting close to us. And we weren't that close, but it was freaking her out. And so I started backing away. And my mom didn't even hear her or anything, and I just kind of pulled her aside, and the dad looks, he goes, "They're okay, honey, they're okay." And then my mom noticed, and she's like, "Oh, I'm so sorry, I'm so sorry." But it's even taking effect on little kids who are growing up on this, like they're panicked.
Yeah. So it's funny enough, Mara was like that. When we were here in New York and people were in, especially in May, was it May of 2021, where, was it May of 2020 or no, couldn't be May of 2020. So it had to be May of 2021 when they now said, if you are fully vaccinated, you didn't need to wear a mask indoors. So we had a grocery store around the corner from us from where we used to live. And here's the problem that I was having with that. It was an honor system.
Yeah.
And back then and still now, there are a lot of people that are anti-vaxxers. They just don't, and which they have a right to, if they want to be vaccinated or not. That's not my issue. But if you are saying that, hey, if you're fully vaccinated, you don't need to wear a mask, but there's no way that you're checking.
Yeah.
There's no system to check. Now here in New York, to go to Broadway, to go to different things, to enter certain places, you have to show proof of vaccination. But back then they were not.
Yeah.
So like, there were a lot of people, it made me a bit nervous because I was like, even though we were still doing 6 feet away or whatever the case may be, the chances of you contracting when one person doesn't have a mask and another person, has one are still quite high.
Yep.
And then it goes really high when both people, so if I'm thinking I'm fully vaccinated and I really am,
yeah,
and I don't have a mask on, but the other person is not vaccinated at all, but because they don't want to wear a mask and nobody's checking, they're like, I'm not wearing the mask.
Yeah.
So here, that we saw skyrocketing somewhere June, July, the cases went up again because everybody was walking around indoors and then outdoors without any mask. And it was like, because, that's what the CDC said this time. So I think, again, yes, for children, my son would go around telling people, where's your mask? Where's your mask, Mom? They're not wearing a mask. And it really, I think, like I said, it raised anxiety for him because I'd educated him about how you stay safe with Corona and how you get it, how you stay safe, what it means. So that he didn't have to, he wasn't questioning or just having unknown fears. But at the same time, he's like, well, people are not wearing their masks. So how do we stay protected? So yeah, I mean, whether it's the vaccinations and even like we've talked now, a lot of the confusion was the mask, the vaccinations, and now the boosters, I think they're saying there's gonna be a third or fourth booster. I think there was already a third one. So a lot of that, I mean, I think it's taking a toll on people.
Yeah.
Like, how many are we going to be taking shots, for how long? And there are a lot of people now that did get fully vaccinated and are just like, that's it. I'm not doing any more boosters. I'm not doing any of that because you just don't know what it is really. And not in the sense of what the booster is, but is the booster going to, is it going to help? Because then the other thing that started happening is, I know someone that was fully vaccinated and had 2 boosters and then got COVID.
Yeah.
So it was like, well, wait a second, because they keep saying just because you're vaccinated, just because you have the booster does not mean you won't get it. So for a lot of people, their questions are now like, well, then what the heck is the point? And they're like, well, if you get it, you won't be as sick or you may not die. But there's some people that have, the full vaccination, the boosters, and get really sick almost to the point that they thought they were going to die. I actually know of several people. So it's all, like I said, all that confusion period messes with me from a mental health standpoint. And then
Yeah.
you add all this other stuff and your body is just out of whack.
And for me, honestly, when the vaccines first came out, my whole family, my aunts, uncles, and everyone, we were very unsure of it. So a lot of us weren't going to get it. Well, I went to my neurologist and he asked me, are you going to get the vaccine? And I go, and my grandma was with me and we are like, no, we're unsure of it. It just came out, like all this stuff. And he goes, I really recommend it for you, Savannah, because I have a seizure disorder and chronic migraine. So we don't know how the COVID's going to affect your body. And so then my grandparents were like, okay, then we're going to get it as well. And so we all got the vaccines. I was fine. Did I get the symptoms of sore body and stuff after the second one? Yes, but everyone was getting that. It didn't affect any of my migraines or any of my disabilities. But when the booster came out, I did not consult with my doctor, and my whole body went haywire. Now, this is not for everyone. Everyone's body's different and everything like that. But I'm just explaining from my personal experience. The booster, I had seizures. I was passing out. My migraines were going crazy. So like for me, if the third, fourth, whatever booster, I'm going to keep consoling my doctor and being like, is this worth it? Because this is what happened the last time. And I suggest the same for everyone who has a disability that the booster can affect.
Right. Or any other pre-existing condition that, you know, because the reality is I've talked to several doctors, they don't fully know what all the vaccines and boosters are doing to our physical body. They don't have a comprehensive idea and can say definitively this is what it is, because everybody's different and everybody's going to react differently. But what is more concerning is nobody has even started to explore, well, not started to explore, nobody has even like a good idea or even a minimum idea of what all this stuff is doing from a mental health standpoint. Because the reality, I don't care what anybody tells you, when you take any kind of drugs, you take any kind of vaccines, anything of that, all that's, the mind and the body are connected.
Yep.
There are neurological or any bodily somatic things happening that we may not be aware of. And so I know that it's been a concern for several friends of mine that I know that, you know, what is this all doing? You forget even from a bodily standpoint, what is it doing from a mental health standpoint? Which kind of leads us into kind of the mental health aspects of this. So I know that back in March of 2020, April, May area, a lot of people got COVID, especially here in New York. I mean, thank God, myself and my son and the two girls that live with me, we were all good. That immediately came to mind once COVID hit was people's mental states. But one of the things that I was just thinking from a panic and depression standpoint, which all of that anxiety and depression skyrocketed. But what it didn't occur to me was when you have COVID, what it was doing to people from a mental health standpoint. So a lot of people that got COVID, one of the things they said was they just have not felt the same mentally. That the stress and just everything of knowing you had COVID just took your mind in places, dark places that you weren't even aware of. So when just in these 2 years, they now have something called COVID depression. That's a main one. Anxiety's through the roof for a lot of people. Anxiety, I felt, was the first thing that kicked in because you just didn't know. There's so many fears and you didn't. And then people, especially here in New York, were dying in groves, like thousands per day. So that just anxiety, the ice so shut down. And for a lot of people that didn't have an elderly that didn't have people around them, the isolation just sent them into a depressive state. And people not being able to physically connect with loved ones
Yeah.
Then domestic violence just through the roof.
Yep.
Substance use and
Yep.
abuse through the roof.
Yep.
And then suicides through the roof. We're still seeing 2 years later the effects of all these different things. And that's one of the reasons why we're having this conversation, is that, yes, everybody was so concerned about, you're going to get COVID, you got to get the vaccine, you stay healthy, your body this, so you don't die. And I kept thinking, I was like, well, somebody may not die from
Right.
getting COVID, but are they going to live after COVID?
Yeah. I have an example. So my mom's friend, she got COVID, and her COVID affected her body differently, but her anxiety was just overwhelming that she's never had before.
Yes.
For-
Go ahead.
No, go ahead.
No,
Okay.
so I mean, yeah, that's a constant theme with many people. People that got COVID.
Mhm.
Unfortunately, my son was one of those people that got COVID when he was visiting in Maine. And I remember, just even for me as a mother, because he was in Maine with his father at the time. And so obviously, given that he had COVID, got to go through, then it was 10 days of quarantine before,
Yeah.
could see him and stuff like that. And I couldn't be there with him through that process. So even my mind, I was like, he's a young boy, he's 6, he now has COVID. We don't know the effects. We know some of the bodily effects, the heart, the breathing, but we don't know the effects from a mental health standpoint. So even if for me as a mother, my mind started going there.
Yeah.
And but this is the great thing about when you have a safety and emotional plans in place, and it's not just for anniversaries. I'm a strong component. You should always have like a safety emotional plan in place, or what I call your wellness plan, so that when life throws you unexpected or repeated curveballs, or just pelts, where it's like you're just being hit like this, that it doesn't completely, you don't completely unravel, that you have the ability to say, okay, I'm going to up this. I'm going to make sure I'm getting more rest, or I'm drinking more water, or I'm connecting with my support system of emotionally safe people more, or, I'm dancing more, I'm painting more, or whatever it is that helps you stay grounded and stay emotionally stable, needs to be increased. And the breathing, or if you have one of the exceptional heroes, that you have those close more often, or if it's meditation or yoga, whatever it is. And so in that time frame, I often do this. I just increase my the frequency of whatever helps me stay centered. I just think it. And I pay attention to my body, like, okay, how's it feeling today? How's my heart? Where's my mind today? And just putting all those things in place. Because like I said, COVID is a traumatic situation. And so those are the things, as we talk about this, and we talk about this, the continued presence of COVID-19, I just can't emphasize enough, as we started, an emotional safety plan is so important. It's imperative for us to heal. It's imperative for us to, say that we're functioning, even on, to some extent. And it's imperative for us to live. A lot of us, like I said, we're having a hard time living and functioning and being during this time.
Thank you guys for watching. I hope you learned something. But wait, before you leave, make sure to visit and follow these Instagram accounts. Check out my website, exceptionalheroes.com, so that you can learn more about my patent pending therapeutic device and to buy some Exceptional Heroes merch. See you guys next time, and always remember to listen, love, connect. Bye.